Skin. It is the largest organ of the human body. It makes up 7% of total body weight. The integumentary system includes the skin and its appendages. Skin has three layers, namely epidermis, dermis, and subcutaneous layer called the hypodermis. Its appendages include hair, nails, sebaceous glands, and sweat glands. Now, let us take a close look at the epidermis, that is the outermost layer of the skin. It is avascular, meaning it has no blood vessels, and it is made up of keratinized, stratified squamous epithelium. The epidermis is derived from the ectoderm. It contains 5 layers from outside to inside. These layers are stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. The first two layers, that is the stratum corneum and stratum lucidum, forms the cornified zone, while the inner three layers forms the germinative zone. The epidermis contains some important cells like keratinocytes, melanocytes, Langerhans cells, and Merkel cells. The keratinocytes produce keratin for strength, the melanocytes contribute to skin color, the Langerhans cells are a part of the immune system, and the Merkel cells detect light, touch, and pressure. A decrease in the number of melanocytes and Langerhans cells increases the risk of skin cancer. This highlights the importance of these cells in protective function. Now, let us move to the dermis. It is the deep vascular layer. As you can see in the diagram, it contains blood vessels, nerves, hair follicle, sebaceous gland, and sweat gland. It is rich in type 1 collagen and elastic fibers. The dermis has two layers, the superficial papillary layer and the deeper reticular layer. The reticular layer forms the main structural component. Stretching of the collagen fibers in the dermis results in stretch marks. The interlocking of the dermal papillae with epidermal ridges strengthens the connection between the two layers. These two layers refer to the epidermis above and the dermis below. The dermal papillae contain capillary loops and free nerve endings. The dermis determines the structural strength and forms cleavage lines, also known as Langer's lines. These lines represent the natural orientation of the collagen fibers in the skin. Clinically, Langer's lines are important in surgery. The incisions made parallel to these lines result in less wound gapping, faster healing, and minimal scar formation. These lines run longitudinally in the limbs and horizontally along the trunk and neck. So, a surgical incision along or between these lines causes the minimum disruption of collagen so that wound heals with a small scar. The pigments like melanin, melanoid, and keratin, along with the blood circulating through the skin and thickness of stratum corneum, determines the skin color. Okay, moving on to the functions of the skin. It protects against abrasion, invasion, water loss, and UV rays. It gives sensation due to the presence of sensory receptors for pain, touch, hot, cold, and pressure. It also helps in temperature regulation by dilation and contraction of the blood vessels. The epidermis of the skin contains 7-dehydrocholesterol that plays a vital role in vitamin D production. Small amount of waste products like urea and ammonia are excreted through the skin. It also has functions like regulation of pH and absorption. It also secretes sweat and sebum. The sweat, when evaporates, decreases the body temperature. Skin can also store chlorides. So, that was a high yield overview of the anatomy of the skin. We will discuss the appendages of the skin in another video.